Video presentation from Department of Panchakarma, Sindhi Shantivireshwara Ayurvedic Medical College, Haveri. This video is about Siragranthi and applied Panchakarma in Siragranthi. Siragranthi is the condition in which vitiated Vata dosha enters in Shira and causes Akshepa, Sankochana, Vishufana and in turn produce Granthi, that is Shiraja Granthi, which can be very well correlated to varicose veins. Varicose vein is the condition in which veins become dilated, elongated and tortuous. Nirukti, the term Siragranthi is derived from Sanskrit. Shira is the vein, Ja is arising, Granthi is swelling. The Shiraja Granthi is literally means swelling arising in the veins. Definition: Shirasu Kutila Sifta Grantilaha Snigdha Varnaha Bahuvedana Piditaha Shiragrantata Ityuchyate. The veins become kutila, swifta and nodular. They appear smooth and shiny. They press, they cause severe pain. This condition is referred to as Shiraja Granthi. Nidana of Shiraja Granthi explained in Shushruta Nidana Sthana, 3rd chapter 11th shloka, and Ashtanga Hridaya Nidana Sthana. Prolonged standing, old age, obesity, pregnancy, overexertion, exposure to excess cold. Purva Rupa of Shiraja Granthi, Sthane Gurutvam, Mrudu Vedana, Tandra, Swalpa Shofa, Vedana Bhava, Tvagvarna Vaikrutyam. Rupa of Shiragranthi, the veins become twisted, tortuous and crooked. Nishpuram, the swelling is non-pulsatile, typically painless, circular or round shaped of the swelling. Unnatam, raised or elevated above the skin surface. Shiragranthi, the condition involving the veins characterized by nodular formations. This is how Shiraja Granthi is defined. Samprapti, due to Nidana, Vata Pradhana Tridosha Prakopa, vitiated Tvak, Rakta, Mansa, Meda and Shira. Sthana Samshraya in both Hadoshaka, Ruja, Daha, Kandu Yukta, Rutta, Unnata Granthi in Hadoshaka to causes the Shiragranthi. Samprapti Kataka of Shiragranthi, Dosha involvement, Vata Pradhana Tridosha, Dhatu involvement, Rasarakta, Mamsa, Meda, Shira, Agni, Jataragni and Dhatvagni, Ama, Jataragni, Mandhyajanya and Dhatvagni, Mandhyajanya, Srotas, Rasavaha, Raktavaha, Mamsavaha, Medavaha, Srotru, Drushti, Sangha, Vimarga Gamana, Shiragranthi, Adhisthana is Hadoshaka, Udbhavasthana is Amashaya, Vyaktasthana is Hadoshaka, Rogamarga is Baya, Madhyama, Sadhya, Sadhyata is Kucha Sadhya. Chitista of Shiragranthi. According to Shushruta, when the veins become abstracted or swollen, Shiraveda should be performed using surgical instrument. Additionally, digestion enhancing and dosha elevating therapy should be employed. According to Charaka, the physician should specify the vitiated doshas, Vata, Pitta, Kapha, according to their specific nature. This should be done through purification therapies like Shodhana, Shamana and Rakta Mokshana when necessary. According to Vagbhata, the condition like Shira, Arbuda, Granthi and Shota, Rakta Mokshana is recommended. If a swelling is not mature, it is considered to be due to deficiency or vitiation of blood. Reference in Bruhatraya, Shushruta Nidana 11th chapter, Granthi, Apache, Arbuda, Galaganda Nidana, Charaka Chikista 12th chapter, Shwayata Chikista Adhyayam, Ashtanga Hridaya Uttarasthana 13th chapter, Apache, Arbuda, Granthi, Adhyayam. Reference in Lagutraya, Madhava Nidana 38th chapter, Granthi Nidana Shloka 16-17, Brava Prakasha 44th chapter, Madhyama Kanda. Applied Panchakarma in Shiragranthi. Virechana can be recommended. Purva Karma, Snehana, medicated ghee like Panchatikta Kruta or Mahatikta Kruta is given for 3 to 7 days to lubricate the body and loosen toxins. And external Abhyanga Vikshira Valataila, Dhanvantaram Taila over the affected area, improve circulation and soften the Granthi. And Svedana Mrudus Bhashvasveda is performed, focused on the limbs to open the channels without increasing Pitta too much, as Pitta dominance can worsen Rakta Dushti. Pradhana Karma, Trivritleha, Best for Rakta and Pitta disorder. Havipatikara churna useful if associated with indigestion or hama. Teranda taila if vata is significantly inward, helps smoothen the action of purgations. Given on empty stomach in the morning after assessing Agni and Bala. Dosha depends on the patient's strength and intensity of dosha involvement. That is, for example, mild for Vata dominant, stronger for Pitta and Rakta Dushti, and what vitals can be checked. Signs of proper Virechana, loose stools which produce heaviness, lightness in the body and clarity in the mind. Virechana Vegas is monitored. Ideally 15 to 20 Vegas indicates a moderate effective Virechana. Panchakarma, the aim is to restore the Agni and ensure the doshas do not aggravate again. Sansarjana Krama, Piyusha, Vilepi, Hakrut, Krutayusha, Mamsarasa over 3 to 7 days. Transition depends on how strong the patient Agni becomes after purgation. Rasayanas, Guduchi and Amalaki support Rakta Tattva and promote vein strength. Kaishara Gukulu is continued to address remaining toxins and prevent reoccurrence and lifestyle mode recommendation. Avoid standing for long period, excessive walking or exposure to cold winds to prevent vata aggravation. Gentle yoga, particularly lake elevation poses, help venous return. Basti Purva Karma Snehana, that is external or internal oleation. External Panchatikta Gruta, Mahatikta Gruta or Kalyanaka Gruta is given for 3 to 5 days to lubricate the body from within, helping to soften the stipend veins. External Abhyanga, massage with Sahacharadi Taila or Dhanvantaram Taila improves blood flow, reduces pain, strengthens the vein walls. Svedana, Nadi Sveda is applied to the affected area, helping to relieve heaviness and promote blood circulation. Dietary preparations, a light warm water specifying diet is maintained to optimize digestion and ensure the doshas are mobilized properly. Pradhana Karma, Anuvasana Basti and Niroha Basti. Anuvasana Basti lubricate the colon, specifies vata and nourishes veins. Ingredients of Anuvasana Basti: Sahacharadi Taila, Kshiravela Taila, Mahanarayana Taila. Dosage of Anuvasana Basti 60 to 100 ml depend on the patient's strength and digestion. Niroha Basti detoxifies and clears Rakta Dushti while balancing Vata. Ingredients of Niroha Basti: Dashamula Kwata, Punarnava Kwata, Guduchi, Trifala Kwata, honey, Saindava Lavana. Dosage of Niroha Basti 500 to 800 ml adjusted based on patient strength. Basti Kala, Matra Basti for maintenance, especially in chronic cases. Yoga Basti for 8 days. Combination of 4 Niroha and 4 Anuvasana Basti for moderate conditions. Karma Basti for severe and chronic cases with deep-seated vata involvement. Paschat Karma, Samsarjana Krama, light digestible diet starting with liquid, soft rice, well-cooked vegetables, gradually reintroducing normal food. Avoid heavy, dry, cold and gas-producing foods that could aggravate vata again. Herbal formulations, that is the Kaishora Gukulu, Sahacharadi Kashaya, Punarnavadi Gukulu. Recommendations: avoid prolonged standing while sitting. Rest with legs elevated to support venous return. Gentle yoga practice to promote blood flow and reduce venous congestion. Rakta Mokshana Purva Karma procedure explained to patient in advance and written consent was taken. Patient were advised to have gentle massage with Sahacharadi Taila to the whole body, followed by Nadi Sveda till the appearance of perspiration on the day of Shiraveda. Patient were advised to have adequate quantity of Tila Yavago before undergoing Shiravedana. Pradhana Karma, the patient was made to sit comfortably over the examination table. The part above 2 angula of Kshipra Marma was cleaned with the surgical spirit. Then a tongue tourniquet was tied at the perforation about 8 inches above the medial or lateral malleoli. The patient is advised to restrain from movements of the limb. Lateral with disposal, needle number 18. The prominent indicated vein was punctured. It was made sure that needle was in situ as blood starting flowing out. Then tourniquet was released and the blood was collected in the measuring jar. Generally after proper vedana, once complete dosha let out. It will stop of its own. Maximum up to 200 ml of blood could be let out. Depending on patient general condition was whichever was earlier. Lateral needle was gently withdrawn. Part was clean and punctured, sighted with the gauge piece, which pressure for hemostasis, then pressure bandage applied at the site. Panchakarma, after 10 minutes of rest, patient can go home and advised to take food which is not very cold, easily digestible, little oil, which promote blood formulation, and either slightly sore or devoid of sore. After Shiraveda, the patient should be asked for a covered exercise, copulation, cold breeze, day sleep, use of alkalis, pungent substances in food, grief, much conversation, and indigestion till he attains good strength. After 10 minutes of rest, patient can go home and advised to take food and which is not very cold, easily digestible, little oily, which promote blood formulation, and either slightly sore or devoid of sore. After Shiravedam, the patient should be asked for avoid exercise, copulations, cold breeze, day sleep, use of alkalis, pungent substances in food, grief, much conversation, and indigestion till he attains good strength. The observation regarding the chances with the treatment was made before treatment on the 7th day, 14th day, 21st day, and 28th day with Shiravedana done. On 1st day, 7th day, 14th day, and 21st day, and the same was recorded in the formorum sheet of prepared for the study. The patient was advised to apply regular stocking or grip bandage and to rest as much as possible with food and elevation. Applied Upakarma in Siragranthi. Atasi Upanaha Purva Karma, preparation of the medicine. Sufficiently quantity of Atasi Upanaha churna was taken and made into paste by adding 10 ml of Murchita Taila, sufficient quantity of water and 5 gram of Saindava Lavana. Thus prepared semi-solid paste was warmed and kept ready. Preparation of the patient was asked to sit comfortably. The affected part of leg was exposed and cleaned with gauze. Then Sthanika Abhyanga was done with Murchita Thaila. Pradhana Karma, prepared Upanaha paste of thickness approximately 1 to 1.5 cm was applied over the affected part of leg in upward direction. When it was lukewarm, then it was covered with Erenda Patra and firmly bandaged with cotton roll, and grip bandaging was done. Panchakarma, Upanaha was retained for 12 hours, then it was removed and the part was cleaned with warm water. Internal medications, Kanchanara Gugulu, Gandhaka Rasayana, Shamana Yogas, Sahacharadi Kashayam, Punarnavadi Kashayam, Dashamula Kashayam, Kaishora Gugulu, Sahacharadi Gugulu, Sahacharadi Taila, Kotta Muchukadi Taila, Trifala Chuna, Avipattikaya Chuna, Chavana Prasha, Brahma Rasayana. Conclusion: Siragranthi described in Ayurveda corresponds to varicose veins in modern medicine. It resulted from vitiated vata and rakta, leading to twisted, swollen veins, often due to prolonged standing, obesity, or genetic predisposition. Management involves a combination of Shramana Chikitsa to balance doshas, Shodhana Chikitsa, detoxification therapies like Rakta Mokshana, lifestyle modifications, modern interventions, early diagnosis on holistic management can prevent complications, improve quality of life, and restore vascular health. Now discuss about the Siragranthi in modern, that is varicose vein. Most varicose veins can sometimes lead to complications but are not serious medical problem. Some complications are bleeding from a varicose vein, blood clot dry, stretched, swollen, itching or scaling skin. Occurs in men and women of any age but mostly affect women in the child-bearing years and older people. Some extremists suggested that about 10 to 15% of men and 20 to 25% women suffer from varicose vein. What are the signs and symptoms of varicose veins? Large veins that you can see on your skin and mild swelling of your ankles and feet. Throbbing and cramping in your legs. Discolored skin in the area around the varicose vein. Painful or heavy legs. How to prevent? You can limit the discomfort of varicose veins by wearing compression stockings, elevate your legs regularly and avoid periods of standing or sitting. How it is treated? Simple test called Trendelenburg test can be used to diagnose varicose vein. Doctors also do tests like ultrasounds and venography. Thank you.